Hello, Magic Family, KG Smooth. We are back at it again here with our good friends at Aetna to present Black Health 365. This is where we address the healthcare disparities that are plaguing our community, especially in the Black community. But we do this with trusted voices and information every day of the year. So I would like to welcome today Dr. Natalie Achong, who is the Executive Medical Director of Strategic Clinical and Business Operations for CVS Health. Dr. Achong, welcome. How are you?
I'm great. Good to be with you, sharing on this important topic.
Yes, indeed, because vaccines have been, it was trending over the weekend, over the Labor Day weekend, like crazy. And so there's a lot of conversations going on surrounding um, that very topic. So, I know everyone doesn't necessarily lean into vaccinations that much, but why are they important? And yeah, let me just start there before I go with this second question. Why are vaccinations important?
Well, thank you for the question, KG. Vaccines are important because they prevent infection, they prevent illness, presenting to the emergency room, and death for COVID, as well as the other leading viruses that we're concerned about. It saves lives and prevents suffering and illness, particularly for our community.
Hmm. And so what is the role of immunizations in healthy aging? Like, because just for myself, for example, 10 years ago, when I'm
Mhm.
here new to Houston, finding a PCP and whatnot, and she was advocating because I had never got the flu vaccine. And so just off the strength of her, just being a Black doctor, I went and got it. I was miserable.
I
So,
appreciate that.
what is the role of immunizations in
Well,
healthy aging?
right. So as we age, we many things come with aging. Wisdom comes with aging, but also risk of infection and also complications that come with these infections. So when we're speaking of infections now, COVID is still among us. As much as the pandemic is formally over, we know from the summer that there are high rates of COVID in our country right now, as well as flu season is upon us. And then there are
Right.
other infections like RSV. So vaccinations are just not for children. They are critically important for adults because as we age, we have complications, particularly in the Black community, that places us at risk. So for those who are older than the age 65, and I know you're not there, but for pregnant people, as well as those in nursing homes or who have just generally lower immune systems, who are
Hmm.
immunocompromised, as we call it, it is important that this prevents the infection in the first place. Then beyond that, it decreases your likelihood of having to go to the emergency room, needing to be hospitalized, having complications, and then even death. Folks die of flu, die of COVID, and die of RSV. These are leading things as we go into the winter season.
Mm. And as we know, sometimes, we'll forget to check in, with you, Dr. Achong, on doctor visits and whatnot. What can lead to the gaps in these vaccination rates and these numbers that we're seeing?
Well,
And
the
why might
perception
Black
is that
communities be hesitant to receiving these vaccines? Well, I think we all know that one, but yes, with the first one.
right. Good questions. Well, I grew up in New York City. I grew up in a Black neighborhood, and I went to medical school in New York City. So I understand it. I am part of this, just like we're all part of it. Generally, based on historical experience and based on being here in America, Blacks are distrustful of the healthcare systems and physicians and nurses and other healthcare professionals. That is part of the experience of being here in the United States. So certainly when we speak of vaccinations, there's a history there that for many people impacts their likelihood of agreeing to get the vaccination, then getting the access to the vaccination, having resources in the community where you can even get them. The COVID vaccine should soon be available. So it's not just a matter of agreeing to the vaccination, but then it's also getting access to the vaccination, having the finances and physical resources to get to the vaccine, and then actually getting the vaccine. So there are many steps.
So, Dr. Achong, what can lead to gaps in vaccination rates, and why might Black communities be hesitant to receive vaccines?
There is a perception that there are differences in the vaccination rates comparing Blacks to whites and Blacks to other communities. And this is a phenomenon. This is an issue that we've seen over decades, that there are differences. So why are there differences? It goes back to what is the Black experience in America. There is a historical distrust based on our experience as Blacks, where we feel hesitancy in trusting systems. And that can often result in those differences, as well as access. In some communities, it's hard to access vaccinations. There may also be misinformation or disinformation. Particularly, we all saw that and experienced that during the pandemic, where there was questioning of science and how we could possibly trust the vaccines and how the vaccines even came about. So thankfully, great messaging through investment, we were able to get over some of that hesitation as a community. Those factors are leading factors for why we see those differences. But the important thing is that once we get access to vaccines that are free or low cost and are convenient and meet us in the community, that we are likely to get them. And it's the most effective way of preventing illness and hospitalization.
Yes. So I'm wondering why, because clearly it sounds like a socioeconomic kind of thing. So why is it harder for the rest of these vaccines to be accessible, but yet this one that they, put out in 2021 was available to everybody, when I'm sure that there are other, flu, just pick doc, there's a laundry list of them. Just pick one that could be given to the public for free, but just.
Why was COVID free? Well, COVID was free because the government paid for it. During the pandemic, there was a long period of time during the highest rates of attack during the COVID pandemic. The government fronted the cost for the vaccinations. Currently, the vaccinations will be given like other vaccinations through a doctor's office or through pharmacies where you present your insurance. And then there are other low cost or no cost mechanisms through health departments and doctors' offices and even some on-site clinics in the community and employers as a means of us not having any obstacles to getting the vaccination. So vaccination as well as testing was free during the COVID pandemic, which ended in May of 23.
This is Black Health 365, and we have partnered with Aetna to provide our audience with resources to prevent and treat issues that affect our communities disproportionately. And it always, bothers me to say that with everything, our community is the one that is affected disproportionately. And we're not doing anything any different than any other community, but yet we have this. It's wild, Dr. Achong. So what is the main health issue impact in Black communities, and how does aging factor in?
So it is true, having been a physician for decades now and working with physicians across the country and with Black physicians, this is something that we struggle with in terms of understanding it and why it continues year over year. But KG, I take encouragement to know that there are opportunities like what we're doing right now, where we get information out. And that is so critical. What we know is that chronic illness is more likely to occur in Black individuals. For example, cardiovascular disease and high blood pressure, stroke,
number one killer,
diabetes, obesity, number one killer of all people in the United States, but particularly among Blacks. When we complicate that with obesity and diabetes, we're more likely to have suffering and then ultimately illness and even death. So this is why vaccinations as a preventative measure to prevent and protect ourselves is so important. The question is that there are obstacles like what we talked about that prevent us from getting those vaccinations. As we age, we typically get more illness, physical as well as mental. So it's important to confront that obstacle with knowledge and best practices that resonate with our community, that mean the most to our community, and come from trusted resources.
Thank you. Thank you for that. Because I think,
You're welcome.
or at least in my mind, like you're right. I mean, yeah, you're really right. And the older we get, the more susceptible we are to things. And so why not have something preventative? But I guess in my mind, even though I am a man of a certain age, I am forever 27 in my mind. So thank you for bringing me back down to earth in reality when it comes to me in my age. But as a Black physician, like what advice can you give our listeners about vaccines, especially for our older listeners?
So for our older listeners and for those that particularly live in settings such as nursing homes or in facilities, or for pregnant people, or for those who have illnesses like the ones we talked about, diabetes, hypertension, stroke, illnesses that affect our immune system, it's important to understand that vaccinations are extremely effective and gone through rigor, and they can prevent us from getting sick. So if you do get sick, you're much, much less likely to actually end up in the hospital and end up in the intensive care unit or even have other complications. One of the complications that we saw, for example, that meets the eye is that many of us have had COVID. I had COVID myself. Every time you have COVID, there's a risk of complications like, say, long COVID. So even though you may recuperate, there's more to it than meets the eye than just the infection. And this is why conversations with a trusted physician or clinician is so important as we get information out. So as we spoke earlier about misinformation, many folks will say, well, I'll get COVID. It's not that bad. And hopefully that will be the case. But in some instances, it may not be the case. And even if you've had COVID in the past, that immunity and protection goes away over time. That's why there was so much talk when the FDA approved the 2 new COVID vaccination boosters last month. So those will be available soon in the community, but they confer protection against the latest variant of COVID, because the variants that we're seeing now are not the ones that we saw back in 2020.
So that
They're
is
always changing. That's what viruses do.
yeah. And so that is why there are all of these boosters, because of the different variants.
That's right. So viruses are very tricky, and that's why there are always new vaccines, say for flu. So every season, the scientists and systems come up with a new vaccine for the flu just for that particular year. So the one that is out now is different than the one that was out last year. Now, COVID doesn't have the seasonal variation. You can get COVID throughout the entire year. This is what we now know. We had the summer surge, which we're currently in right now. So the current boosters, the ones that were just FDA approved, actually take and target the newest variants that are out there. And I won't go into detail about all the different variants that are out there, but even in the last few weeks, there are newer ones that were not there weeks ago. This is why it's so important to get whatever protection there is out there. And certainly a vaccination with the latest booster and being up to date on all your vaccines is so important, because
Yes,
that's
indeed.
that first line of defense, if you will.
Mhm. And where can our listeners get their vaccines?
Great question. So once you've connected with your physician or clinician, you can discuss options. But for the most part, there are many great options in the community. One of the leading options is your pharmacy. Those who are Aetna members can go to their local CVS pharmacy where they can get vaccinations, even multiple vaccinations at low cost or no cost. But for everyone, great options are your doctor's office or the health department or your local pharmacy.
For sure. And what resources do CVS Health and Aetna provide for those who are looking to stay current with their vaccinations?
Thank you. So Aetna CVS, we all know our Aetna pharmacies. We have minute clinics as well as actual providers that are within the pharmacies, and they can actually work with you after you make your appointment. You can even make appointments online. You can meet with the providers within the pharmacy and they can give you your vaccine. In fact, even your whole family can go there. We see people of all ages at the CVS stores and Minute Clinic.
For
So
sure.
check it out.
Well, yeah, absolutely. Well, I'm on behalf of me, um, thank you. And personally, I miss Aetna. You know, we used to have you all. We don't. I miss it. I miss you all. I wish we would come back to you all. I miss you all. You guys were. You're the creme de la creme. I had no problems with Aetna. I had no problems with Aetna. You guys are amazing, and thank you, Dr. Achong. Before we leave, are there any final words that you would like to share for the people at home?
Well, thanks for the opportunity to share this word with your listeners all across the country. I would just say that as we come to flu season and as we're still experiencing COVID infection at high rates, protect yourself, protect your loved ones. Vaccines are not just for children, they're for everyone. I encourage you to reach out to your trusted physician or clinician and talk more and protect yourself, because it's important to take this under your own hands and get the best care you can to live as long as you can.
Indeed. Well, thank you so much, Dr. Natalie Achong, Executive Medical Director of Strategic Clinical and Business Operations for CVS Health. Thank you so much for sharing your scholarship and, easing some of the anxieties that some folks, myself included, have about these vaccines. For more information and everything Aetna Black Health 365, you can log on to Aetna.com. And again, Dr. Achong, thank you so much. And to all of you out there, to my radio family. Oh, and you can follow them at Aetna on all social media, especially on Instagram at Aetna. Thank you all so much. Magic family, I am KG Smooth.